Welcome, students, guests, and faculty to the School of Nursing pinning ceremony for summer 2021. My name is Dr. Kristen Munyon, and I'm the undergraduate program director. I'm also an assistant professor in the School of Nursing, and I'll be your host for this evening. It is so great that we can actually be together. This is our first in-person pinning that we've been able to have in over a year. The pinning ceremony is a time-honored tradition for nursing students dating back to the turn of the 20th century. It is a unique homage to what you, as nursing school graduates, have accomplished over the course of your education, as well as a symbolic welcome into the profession of nursing. The pin presented to you tonight will represent your dedication, commitment, and professionalism to the nursing practice. To start the ceremony, let's welcome the Dean of the School of Nursing, Dr. Judy Didion, to the podium.
Wow. You know, it's really touching because we've been through so much together, haven't we? This last year and a half, 2 years, it's been a tough time for a lot of people. And when all of you walked in, it was like, this is what it's all about. This is what it's all about. All of you out there will be our next group of healthcare providers. And you're beautiful. You look great all dressed up, and it's just a beautiful, beautiful time. And I'm so happy to be here tonight. So I just want to welcome all of you, our esteemed faculty, staff, friends, and family of our graduates. This is an exciting moment. You are joining the ranks, in my opinion, the noblest profession, the most trusted profession, nursing. This ceremony tonight is a reflection of the many nurses that came before you. Perhaps some of these nurses are close relatives, friends, or faculty members. Maybe they inspired you, and that is why you are here today. Throughout the history of nursing, many nurses cleared the path for our profession. Their paths taught us how to provide care, but their determination and persistence challenged us to continue their work. Florence Nightingale, who turned 200 last year, discovered that hygiene and good nutrition decreased mortality rates of wounded soldiers in the Crimean War. She also established formal education for nurses. Lillian Wald, a leader in public health, improved the health of workers living in New York City tenement houses by visiting them in their homes and establishing school health services. In the 1950s, Sister Jean Ward, who was a nurse on a premature infant ward, discovered that the use of sun therapy reduced jaundice, and now phototherapy is used as a common treatment today. Other nurses invented feeding tubes, self-care management strategies for diabetes and asthma, wound care strategies, and improved techniques for pain management and patient assessments. And think about what all the nurses did in the last year and a half to innovate with COVID. If it weren't for them, we wouldn't have developed the therapies we have today. So your pinning celebration today marks your entrance into this profession where nurses provide care and also lead the change to improve care. Nurses make a difference in the lives of individuals and patients and populations. With the excitement and perhaps trepidation about beginning your nursing career, leadership and change may not be at the top of your mind. Perhaps you're only thinking about learning the ropes and becoming a competent new graduate. But soon you'll find, as your comfort level increases, that patients, families, and peers will rely on you for your leadership skills. You will find yourself challenged to make good decisions and think critically about the best approaches for care. The pin you received tonight is a badge and marks your transition at Oakland University School of Nursing from student to nurse to leader. The knowledge and skills you have attained through your program of study equips you with the ability to influence others. This includes your patients and families, your peers, and other healthcare team members, as well as the community. So I urge you to think of yourself in these terms. As you design systems of care and as you advocate for patients and families to be part of the healthcare team. So I would be remiss, though, because we need to address the support and encouragement of all your friends and families who have gave your assistance, guidance, and comfort whenever it was needed. Someone said the other day it takes a village to be a nurse, and I really do appreciate that. And I want all of us to give a round of applause to all of these great people in this room. Because they helped you be who you are today. So it is with great respect that I look to you, family and friends, and thank you for enabling your graduates to be here today. So let's appreciate each other and enjoy and celebrate not only our graduates' accomplishments, but all of your accomplishments as well. So graduates, I'm honored to welcome you to the world of professional nursing. So congratulations and best of luck. So it's my pleasure now to introduce our first student speaker. So our first student speaker of the night represents our accelerated second degree program. Please join me in welcoming Lori Brooks to the stage.
All right. Well, I'm humbled and honored to be speaking to you all today on behalf of the accelerated, not abbreviated, second degree nursing program. To my classmates, you are intelligent, motivated, humble, selfless, passionate, goal-oriented, and now probably a little bit more emotionally stable. I thought during this speech we could take a quick walk down memory lane. Remember how excited we all when we first received our letter of acceptance? Some of us had just completed our first bachelor's degree. Some of us were starting a new career after being in other healthcare careers, some in non-healthcare careers, and some even in the military. To my classmates, you all truly amaze me. We come from so many different backgrounds, cultures, cities, states, countries, yet we all got placed on this journey together to become nurses. Remember our first day at orientation? That was the last time we all were together. We had so many concerns, questions, doubts, anxiety about how this program would go, who would we meet, do we have what it takes, how can we make the biggest difference? We had no clue what was about to really hit us. At our first day of orientation, MSU came out and publicly announced that they would have all virtual classes due to the pandemic. Campuses across Michigan started closing, and we found out that we too would be doing all virtual classes and virtual clinical. So all that business attire that we had bought for the Anton Frankel Center got shifted towards the back of our closet, which didn't end up being so bad after all. We started with Patho, health assessment, intro to nursing. Many of us went into the first semester thinking that there were only 10 credits and we can kind of ease our way in. Well, boy, were we mistaken. Patho was hard. So much to learn and remember. So many PowerPoints. Thank you for getting us through, Dr. Hernandez. For many of us, this might have been one of our biggest challenges. Health assessment was fun, actually hilarious at times, but challenging with what we had available virtually. Most of us did our first wound dressing change on a maxi pad, our first fully catheter on a tube and sponge from Home Depot, and hung our first IV bag on a closet door or some door at home. Thank you, Professor Morse, for being so creative and for also introducing us to the claw. I will never look at a sterile environment the same. Intro to nursing with Dr. Newton was tough, but her high expectations were echoed throughout the program. First semester was spent completely online, not only trying to navigate the beginning of nursing school, but also trying to navigate a program that usually is in person and was forced online due to the pandemic. It was challenging for us students as well as the professors. And can we say tech issues? Oh boy, were there tech issues. I wish we could have a bloopers video. And also, thank God for Facebook, which I never actually thought that I would say. But just when you were starting to panic because you weren't able to get into the Zoom class or you weren't able to get into your test, you could check our Facebook cohort and realize that 60 other students were also freaking out with you. The biggest comfort was knowing that we were never alone. We continued to navigate through our next semester with Pharm, Fundamentals, Med-Surg 1, and Research. We were able to start in-person clinical for Med-Surg, which was so exciting. Thank you to Catherine and all of our clinical faculty for working tirelessly to keep us in person as much as possible. The start of our next semester was exciting, and we felt like, wow, we made it halfway through. We could totally do this. We started with mental health, which pretty sure we all thought we had every single thing that Dr. Shaheen talked about. Can we also say nursing diagnosis of ineffective coping as related to poor impulse control and frustration tolerance as evidenced by excessive alcohol intake or maybe impaired memory? After we were done diagnosing ourselves with every mental health disorder possible, we started OB. OB was hard with an exclamation point. Please select all that apply. Med-Surg 2 and informatics were also part of getting us past the midway point of our nursing school careers and more in-person clinical. Did I mention how much we love you, Dr. Bonnie? We finally entered into our last semester. The pandemic's still in swing, class is still online, and to be honest, at this point, I think most of us were happy to roll out of bed and sit in front of our computer instead of dress up and go to the Anton Frankel Center. We finished up with leadership, PEDS, community health, and our capstone class. There's so many things that I could elaborate on, but they asked me not to stand up here all night. So I will close with this. First, I want to thank God. Without him, none of us would be here. I have an incredible amount of faith, and I truly believe that God placed me here with all of you for a reason. You have taught me invaluable lessons that I will take with me for the rest of my life. I'm beyond thankful to have you as my classmates, as my professors, and future colleagues on this crazy journey of nursing school during a pandemic. To all my classmates, you are an incredible group of people with stories to tell, lessons to share, and families and friends that have stood by and supported you throughout this journey. With that being said, on behalf of all of us students, thank you. Thank you to our professors who have taught us so much more than what's in the book or how to pass the NCLEX. Thank you to our significant others, husbands, wives, fiancés, mothers, fathers, sons, daughters. Thank you for understanding that when days, weeks, or maybe months pass without us being able to see you, know that we were working on minimal sleep and we missed you. We were working on making a difference in the world, in people around us, and learning how we can impact a person's life by showing love and supporting them at some of the worst times in their life. And to my classmates, to this incredible group of soon-to-be RNs, we did it. Congrats, summer 2021 graduates. I'm going to end with a quote from Maya Angelou. As a nurse, we have the opportunity to heal the heart, mind, soul, and body of our patients, their families, and ourselves. They may not remember your name, but they will never forget the way that you made them feel. Thank you.
Thank you so much, Lori. That was so nicely done. Our next student speaker is Alyssa Schenken, and she's representing our basic BSN cohort. Please welcome Alyssa to the podium.
Hello, everyone. It's an honor to stand here today and speak on behalf of the Oakland University School of Nursing Traditional Track Summer 2021 graduates. We've all been waiting for this moment for years, and it's finally here. We made it. I know how hard we have all worked, the sacrifices we have made, and the stress we all felt, but we did it, and I'm so proud of this cohort for achieving this goal after all that we have been through. I would like to begin by thanking you all for coming and celebrating this momentous occasion with us. None of us got here alone, and your support these past few years means more than you know. I would also like to thank all of our amazing professors here who taught us all so much in so little time under unfamiliar circumstances. Your hard work and dedication to our education through the chaos that is our new normal is a large part of how we have made it to this moment. Thank you for believing in us and supporting us through our journey. Today, we celebrate no longer being nursing students, but graduate nurses. I think I can speak for all of us when I say that this is not how we expected our time in nursing school to go. For those here who have not been through it, I want to try to describe it to you. Nursing school is where you learn that you're never truly right, because even when you choose a correct answer, it's not the best answer, or you missed one option on a select all that apply, and no, there's no partial credit. There are studying binges and all-nighters, and then there are sim labs where you need to learn to be both a nurse and an actor, and clinicals where you learn that placing a catheter in a real live human is really different than placing it in a mannequin. But joking aside, nursing school is also where you meet amazing, kind-hearted people that you're proud to join a profession with, and you realize that it's all worth it. While nursing school was never easy, our class faced additional challenges that were certainly not on the syllabus. In a time of chaos, loss, and fear, we persevered. During the pandemic, many of us were on the front lines, witnesses to pain and suffering, and we chose to continue and to fight. In a time where many are leaving bedside nursing, we go forward and we take up the challenge. We all chose to be nurses for a reason, and I am proud of each and every one of you for how we have handled a precarious situation and made the best of it. While everyone else stayed home, we worked in hospitals, we were caregivers, and we volunteered at vaccination clinics. While it's been difficult, our efforts have saved lives, and as nurses, we'll continue to save more. To do what nobody else will do in a way that nobody else can, in spite of it all, that is what it is to be a nurse. Caring hearts may have led us to being nurses, but it's our strength and dedication to others that makes us stay. As nurses, we have a unique opportunity to make a real difference in the lives of others, to be an advocate for those who cannot speak for themselves, and to be a first support for those who have no one else. I know that we will make a difference because I have the honor of knowing so many of you and the differences you all make every day. While we see people at their weakest and most vulnerable, we then often have the privilege of helping them heal and regain their strength. While sometimes we are part of people's darkest days, we also get to see their brightest. We have chosen a career that is purpose-driven and bigger than ourselves, and I know we truly cannot imagine doing anything else. I'm proud to join a profession of healers and dedicate my life to caring and loving others. You should all be so proud of your accomplishments and what you've overcome. I know you'll all do great things and change lives for the better. I cannot wait to work with you all and be the change the world needs. I want to end on advice given to me by other nurses. Never forget why you wanted to become a nurse. Be the nurse your patients need you to be, and the nurse you would want to have. Your first real job as a nurse is going to be scary, but you know more than you think, and what you don't know, you will learn. Congratulations, everyone. This is a moment to be celebrated and to remember with pride as you begin your nursing career. Thank you. It's my honor to introduce the faculty keynote speaker that was selected by this graduating class to speak to us tonight. Please welcome full-time adjunct assistant professor and fellow alum, Dr. Katie Meissen.
Hi, everyone. Thank you so much for having me. I am so honored to have been chosen to speak to you all today. And I'm so excited for you as you begin your nursing careers. Some of you are here today because being a nurse is something that you've always wanted to do. It's the only career you ever thought about doing. I wasn't one of those people. I didn't always want to be a nurse. It was never even on my radar. I actually wanted to be a newscaster, and I think I would have been a really good one. I didn't know I wanted to be a nurse until I was 19 years old. I was 19, single, and about to give birth to my oldest child. The people who got me through what was at that moment the most terrifying time in my life were the nurses. They comforted me, they encouraged me, they told me that I was going to be okay, not just in that moment, but in life. Little did those nurses know, they also showed me a career path. I knew when I left the hospital that I was going to nursing school. One of the things that I love most about nursing is the variety of opportunities that are available to us. Nursing has taken me to places that I didn't even know I wanted to go. It has allowed me to do things that I didn't even know I wanted to do. I have worked as a cardiac nurse in Detroit. I have worked as a public health nurse in Lapeer County. I worked as a school nurse at a large school district in Flint. That was a job that I loved. I did not love all the head lice that came with it, but I did love the job. It was there that I learned that all people are not treated equally. Healthcare is not accessible to everyone. The things that are simple for me and my family are really complicated, if not impossible, for others. It was there that I got the feeling that I could do more. I didn't know what, but I knew I could do something. While I was working as a school nurse, I was also going to school. I became a family nurse practitioner working in primary care. For several years, I worked for family practices that were owned and operated by large health systems. When you work for a large health system, you kind of see the patients they tell you to see. For the most part, you see patients who have insurance, who have the means and the resources to get to the office to see you. But what about those people who didn't have those resources? I still felt like there was more that I could do. There was still something. And so, after several years and a lot of research, I decided that I was going to start my own practice. I started my practice kind of on the side, seeing patients in their homes and doing telehealth. Yes, before telehealth was cool. Because it is my practice, I get to choose who we see. So we see a lot of homebound seniors. We see patients who are uninsured or underinsured. We see patients in assisted living facilities. We see patients at a youth treatment center. We're seeing the patients that no one else wants to see. We're treating patients who no one else wants to treat. Because if not us, then who? My practice has grown from just me working out of my house to a practice with almost 1,000 patients, another nurse practitioner, and 2 assistants. We even have an actual office now where we also see patients. I have to tell you though, I had absolutely no idea how to run a business. I kind of still don't. But I didn't know how to do a lot of things. But I knew I could do something. In addition to my practice, my nursing career has allowed me the opportunity to do some global health work. A few years ago, I traveled to Nicaragua on a medical mission, along with 4 other nurse practitioners, some nursing students, and 5 nurses. We treated over 450 patients in 3 days. These were patients who lived in remote villages, some of whom hadn't seen a health care provider in several years. On the plane back home from there, I was thinking about those patients. I was thinking about the fact that we had been there and treated them. We had given them meds that would get them through about 3 months, but then what would happen to them? I wondered how we could provide them continuity of care. It dawned on me that in most parts of the area, we had some cell service. There was internet access in one of the schools in the village. If they had internet access, we could provide telehealth. So as soon as I got home, I contacted the organization that we partnered with in Nicaragua and began the process of starting my own nonprofit organization. We developed a pilot project in which we would set up a telehealth clinic in Nicaragua. We would hire a nurse to take vitals and help on that end, and we could provide ongoing care via telehealth on our end. The project, of course, is on hold right now due to COVID travel restrictions, but we're just waiting for the green light to get that going. Now, I knew absolutely zero about starting a nonprofit, especially one with a global focus. I definitely didn't know how to do everything, but I knew that I could do something. Speaking of COVID, when it first started, I decided to go back into the hospital to try to help. There was a shortage of nurses and way too many patients. I hadn't practiced in the hospital in a really, really long time. So I didn't know what I could do, but I knew I could do something. My job in the hospital was to be a runner, which basically meant just do what everybody tells you to do. So I fed patients, I turned patients, I changed linens, I ran and grabbed supplies for the nurses who were in the rooms. I remember one particular patient who was really, really sick. One day, my entire shift consisted of giving him sips of water and bites of food while he struggled to breathe. I'll never forget the look on his face. He was so tired. There was really nothing to be done. The only thing I could do was give him water and hold his hand. So that's what I did. If I have taught you in the last year, then you know that my family is currently going through its own health crisis. In September of 2020, my 47-year-old husband was diagnosed with pancreatic cancer. I said I wasn't gonna cry. If you know anything about cancer, you know that pancreatic cancer is not a good one. I'll never forget the day that he was diagnosed. He had a biopsy, and the surgeon called me down to the recovery room. Because of my experience and knowledge of how things work, I knew what was coming. I knew in my gut that it was not going to be good news. It's different to know that and to hear it out loud, though. To hear the surgeon tell me that my husband of 17 years, the father of my 4 young children, had inoperable terminal cancer was devastating. And when I got the most devastating news of my life, it was a nurse who literally held me up. It was a nurse who put her arm around me, who hugged me, who comforted me. Now, my husband is almost 1 year into his cancer journey. He's been through a few different chemo meds, a failed attempt at surgery, and radiation. It's the oncology nurses who get him through his chemo treatments. They not only give him the medication that is currently keeping him alive, but they also give him the bucket when he's gonna vomit. They give him the water when he's thirsty. They comfort him. They encourage him. They can't do much. They can't make his cancer go away, but they can do something. And the oncology NP, who kind of oversees my husband's care, she's an OU grad and a former student of mine. So as you begin your nursing careers, I would like to encourage you to be open to seeing the problems. You can't fix something that you can't see. When you see the problems, when you see the holes, when you see the gaps, they are there. When you see them, figure out what you can do to fix them. Do something. Listen to the voice in your head that tells you there must be a better way. Sometimes doing something means doing something big, like starting a business or a nonprofit. Those big somethings are important. Things don't change unless we change them. Problems don't get solved unless we solve them. If not us, then who? There will be opportunities for big somethings, but also don't discount the little somethings. Sometimes those little somethings, telling a scared teenager that she's gonna be okay, giving a sip of water to a dying man, clean sheets, a strong arm to lean on, a gentle hug. Sometimes those little somethings are everything. Congratulations.
Thank you, Dr. Meissen, for your heartfelt words. We will now begin the awards presentation. And for this, I'd like to welcome to the podium Dr. Carrie Book, Associate Dean in the School of Nursing.
Hi, everyone. Thank you, Dr. Munyon. Among this group of graduates tonight, there are several exceptional nursing students that have been selected to receive Special Achievement Awards. I'm honored to be able to acknowledge the high achievements of the following award recipients. The first award is the Board of Visitors Excellence in Nursing Award, which honors a graduating student who shows strong academic and clinical performance and has demonstrated high-quality professional nursing care. The Board of Visitors Excellence in Nursing Award goes to two students, Megan Woods from the RN-BSN group and Alex Van Luvender from the ASD group. Megan is unable to be with us tonight. Alex, please come up to receive your award. Congratulations, Alex. Our next award is the Elsevier Health Sciences Book Award. This award is given to a graduating student who has demonstrated noteworthy caring behaviors in clinical practice that exemplify both humanistic and altruistic values. This year, the awardee is Kasim Quinbar. As tradition has it, Kasim is being presented with the second edition of Nursing, the Finest Art, an Illustrated History by Patricia Donahue. Congratulations, Kasim. The Exceptional Achievement Award is given to a graduate who, in the judgment of the faculty, has demonstrated an outstanding level of academic and professional performance through his or her exceptional contribution to the promotion of high-quality healthcare or contribution to the advancement of nursing knowledge. There are 2 award winners. Hope Wheeler from the ASD cohort and Amanda Peterson from the RN-BSN cohort. Congratulations, Hope. Come on up to receive your award. And unfortunately, Amanda is unable to be with us tonight. Congratulations again, Hope. The next award is the Leadership Award. This award acknowledges a student who has demonstrated exceptional professional and leadership qualities related to the healthcare needs of the community and supports the School of Nursing through extracurricular involvement. The Leadership Awards this year go to Lori Brooks from the ASD cohort and Kelly Prince from the RN-BSN cohort. Come on up. Congratulations, Lori. Congratulations, Kelly. Congratulations again to all of our award winners.
It's now time to begin the pinning of the BSN graduates. To assist with this, may I please have Dean Didion and Dr. Booth continue to stay on stage. Graduates, you will now be ushered to the stage with your pinners. Please bring your index cards with you. As you leave the stage, please file back into your seating area. The pinning ceremony has long been a rite of passage to celebrate the accomplishments of nursing graduates and welcome them into the professional world. I'll give you a moment to come on up.
Do the pinners know what to do?
I think so. They gave them some directions in the bound room. Wonderful. Coming up, Laura. Thank you so much. We have Lori Brooks, pinned by Dorothy Jenkins. You can come on over.
So, Dr. Bonner.
If Dr. Bonnie would mind pinning Lori for us, since Dorothy couldn't join us this evening. I see her. Perfect. Jacob Fisher, pinned by Lauren Gillardone. We have graduate Bailey Davis, pinned by Lori Post. Graduate Christina Miller, pinned by Kara Westra. Graduate Amber Musso, pinned by Florinda Nani. I apologize. I was just informed we have some thank you messages I can read to you. Amber indicates, I just want to give a huge thank you to my mom and dad for making college possible for me. And I would also like to say thank you to Florinda for taking me under your wing and teaching me so much throughout the years. Next, we have Brooke Granite, pinned by Marissa Granite. Brooke says a special thank you to my parents and family for being the biggest support system to me while going through nursing school. I could not have done it without you. Next, we have graduate Diane Maxwell with pinner Laurel Feldkamp. Diane writes, thank you to all of the greatly inspiring nurses that have been a part of my education. My mother, who is pinning me today, is a great inspiration to me to become a nurse and has always provided support, encouragement, and mentorship to me for nursing and life. Thank you, Mom, for making this possible. Alyssa Schenken is pinned by Dr. Didion. Alyssa writes, thank you to Oakland University and its amazing instructors for preparing me to be a nurse. And thank you to my family for their support throughout my education. Graduate Elizabeth Offer is pinned by Professor Leah Morrissey. Elizabeth writes, I'd like to thank my family and friends for all their love and support throughout my time in the nursing program. Also, I would like to thank my instructors at Oakland University for their guidance, patience, and encouragement. Samantha McLean is pinned by Leah Morris as well. Thank you to Oakland University and all the SON faculty for facilitating my learning. I am beyond grateful for the connections made throughout this program that have helped me to grow. Kiara Nailson, also pinned by Leah Morris. Kiara says, thank you to my friends and family who have supported me through my nursing journey. Aristida Plumai, also pinned by Leah Morris. She says, thank you to everyone who has supported me throughout these years. I am looking forward to facing the world as a new graduate nurse. To my family and fiance, thank you for being there every step of the way. Megan Downey, being pinned by Layla Kulaglik. Megan says, thank you to my professors, preceptors, and coworkers who have taken the time and patience to be my educators and positive influences over the last 4 years. Brandon Warda is pinned this evening by Matt Rizzi. Brandon says, I would like to thank all of my professors and clinical instructors for all the time and dedication they had put to help me become the best nurse that I can be for the future. I would also like to thank my parents for helping me get through nursing school and for everything they do for me. Stephanie Allen will be pinned this evening by Emily Allen. Stephanie writes, I would like to give a special thanks to my mother, sister, and brother for their continual support and encouragement throughout my nursing journey. I appreciate all that you do and am truly grateful to have you in my life. I couldn't have done it without you. Vera Hakim will be pinned by Dr. Didion. Vera writes, thank you to my family and friends for helping me to get where I am today. Rosalind Schossberger will be pinned by Dr. Didion as well. And she writes, I want to thank my family, friends, and peers for supporting me over the last 3 years and cheering me on until the very end. It wasn't easy, and it wouldn't have been possible without your love and support. Hadia Manavi Salinas, pinned by Dr. Didion, writes, I would like to say thank you to my entire family, but most especially to my aunts and uncles, because without them, I would not be here today. Mom and Dad, I did it. Anissa Hoxa, pinned by Dr. Didion. She writes, thank you to every professor for sharing their knowledge with us and supporting us. Audrey Kameni, pinned by Dr. Didion, writes, I want to thank God for giving me the health and strength to finish this program. I would also like to thank School of Nursing faculty for their hard work and dedication throughout the program. Erin Heiner will also be pinned by Dr. Didion this evening, and she writes, I would like to thank all the wonderful professors and lab instructors for providing me with the education and skills I need to help others. To my family, thank you for being my biggest supporters, my motivators, and for being with me every step of the way. It wasn't easy, but we finally made it. Kristen Bremer, being pinned by Dr. Didion this evening, says, I want to say thank you to all my family and friends for their love and support during my time in nursing school. Your kindness and patience did not go unnoticed. Adrienne Hildebrandt, also pinned by Dr. Didion, says, I would like to thank my parents and family members for their unending support and motivation, and all the amazing professors and colleagues that are now friends that I've met along the way. Summer Zarzicki, pinned by Dr. Didion, writes, thank you to my family for giving me all the support. Sarah Seaton, pinned by Dr. Didion. I would like to thank all of my friends and family who supported me throughout my journey in nursing school. I am very blessed to be presented with the opportunity to pursue my lifelong dream of becoming a nurse. Corey Kennedy, pinned by Dr. Didion this evening, says, I would like to thank my parents and my girlfriend for all of their continued support. Thank you to my fellow classmates for working through this difficult program together. Lastly, I want to thank me for doing all this hard work. Kyle Gross is pinned by Dr. Didion this evening. He says, thank you to my family for their unwavering support throughout my educational journey. Long before OU could teach me, you gave me the heart of a nurse. Samantha Brodzik, pinned by Dr. Didion. Samantha writes, thank you to my mom and dad for being the biggest supporters in this journey and every moment of my life. Jillian Labastida is pinned by Josephine Labastida. Melissa Caston is pinned by Lisa Caston this evening. She writes, to my father, I will continue to make you proud. Love you forever, Robert Wayne Caston. Emily McConnell will be pinned by Dr. Didion tonight. And she writes, I would like to thank my family and friends for their endless love and support through all the good times and all of the bad. Victoria Menasee, pinned by Dr. Didion. Victoria writes, I just want to thank everyone who has never given up on me. It's been a tough couple of years, but I finally did it. Diana Trish, pinned by Judy Didion this evening as well, writes, thank you, my family and friends, for helping me in achieving my goal. Ursula Cole, pinned by Dr. Didion, Writes, thank you, School of Nursing, for helping me achieve my goal of earning my degree. Also, thank you, Charles, Ryan, and Adam, for being there with me through it all. Isoon Quinn, pinned by Dr. Didion, says, Dear Bill and Tu, thank you so much for helping me through school and achieving my goal. Thank you. Maika Naylor, pinned by Lisa Naylor. Maika writes, my family has been there every step of the way, praying and praising. I am very thankful for all the love and support. Marcrease Adams, pinned by Kimberly Neal. She writes, I would like to thank my family for their moral support. If it were not for you guys, I would never have made it. I love you with all of my heart. Jillian Barrow is pinned by Rebecca Johnston. Jillian writes, thank you to everyone who helped me get to this point. I could not have made it without you. Joshua Celestri, pinned by Caitlin Bershowski. Joshua writes, I would like to thank my family, friends, mentors, and puppy, Walter, for their support through the program. Thank you. Molly Jordan is pinned by Mariah Cook this evening. Molly writes, Molly would like to thank her family, Andy, Mariah, her dogs, and her therapist for their support getting her through this program. Hope Wheeler is being pinned by Cindy Wheeler, and she writes, thank you to my family for their support during nursing school. Courtney Wilkie will be pinned by Janice Wilkie this evening, and she writes, thank you to my family and friends for your endless encouragement and patience throughout this program. Jacob Garvelia is pinned this evening by Brizita Metmeya. And Jacob writes, I want to thank my friends and family. I would not have made it this far without you. Graduate Zachary Smith is being pinned by Wendy Yee this evening, and he writes, thank you to my fellow students for making this such a memorable experience. Most importantly, thank you to my family for inspiring confidence in me throughout this journey. Sarah Rafalco is pinned this evening by Caitlin Rafalco, and she writes, I want to thank my parents who've always supported me in everything that I do. I also want to thank my sister Caitlin, who's been someone I've looked up to my whole life, and especially now as a fellow nurse. Jordan Clemens is pinned this evening by Kelly Manders. Jordan writes, I want to thank my mom, who I'm so lucky to have here to pin me today. Thank you for encouraging me to do all the things with love, compassion, and care. I can only hope to be half the nurse you are, and I promise I'll try my best. Katie Chadwell is pinned today by Erin Marecki. Katie writes, thank you to Erin, my parents, and my friends and family for all the support the past 16 months. We'll get it right. Graduate Christine Lubkovich is pinned this evening by Denise Lubkovich. She writes, I would like to thank my family and friends who have supported me throughout this last year. From going over case studies with me to pretending to be my patients, thank you. Catherine Burlage is pinned tonight by Cheryl Burlage. She writes, I would like to thank my family, especially my husband and son, for being so incredibly supportive during this intense year. Without their understanding and encouragement, I would not have realized my dream of becoming a nurse. Mitchell Lay is pinned this evening by Jacob Gerlach. Mitchell writes, thank you to all my family and friends who have supported me throughout this journey. Matthew Griffin is pinned this evening by Inger Griffin. Matthew writes, thank you to my family for supporting me and allowing me to focus on school. Cassandra Wagaster is pinned this evening by Ashley Sinpinski. Cassandra writes, thank you to all my friends, family, and the faculty who have helped me throughout this journey. Angela Lee is pinned this evening by Lily Wen. I want to thank my family and friends for supporting me throughout this journey, and thank you to the wonderful faculty and clinical instructors that helped me get there. Chanel Jarbo is pinned this evening by Taylor Kizzy. Chanel writes, I would like to thank my family, friends, and Oakland University's nursing staff for their continuous support during my nursing journey. I will forever be grateful. Sarah Gothier is pinned this evening by Dr. Rebecca Bonney. Sarah writes, thank you to my family and friends who supported and motivated me through this insane program. I love you all. Miriam Begale, pinned by Dr. Bonney, says, thank God that I have parents who always pray for me and giving me emotional support. Special thanks to my daughter, Fatima, for being my rock. I am also grateful for having you in my life. Thank you to my husband, Hussein, for his love and constant support throughout all of this program. Irande Rajagurubanda, pinned by Dr. Bonney. I would like to thank all of my wonderful educators and staff from Oakland University, my family, and all the colleagues who supported me during this journey. Scott Campbell, pinned this evening by Lisa Whitaker, writes, thank you for your time and patience. You have truly made me a better nurse. Amber Lofton is pinned this evening by Lori Post. Amber writes, thank you to everyone that supported me along this journey, my family, friends, classmates, professors, and preceptor. Kiara Harris, pinned today by Amber Zimmerman, would like to say thank you to Dejan as well as to everyone who has helped her on this journey. She says, I'm so excited to finally start my career as a nurse. Taylor Clark is pinned this evening by Taryn O'Toole. She writes, thank you to my husband Ryan for cheering me on and keeping me sane. Brandon Dion is pinned by Taryn O'Toole as well. Brandon writes, I want to give a big thanks to my entire support system that has helped me along the way over the past 16 months. Without your support, this achievement would not have been possible. Riam Bakas, also pinned by Taryn O'Toole, writes, I'd like to say thank you to my family and friends who have always supported me throughout my education. I would not have been able to get through this program without them. Alex Van Luvender, also pinned by Taryn O'Toole this evening, writes, thank you, Oakland University, and my classmates for their continued support. Thank you, Taryn O'Toole, for helping me find my passion in L&D and my family for always keeping me going. Cheyenne Calderon is pinned this evening by Dr. Didion. She writes, "Thank you to my parents for loving and supporting me so that I could pursue my dreams of becoming a nurse." Anna Fasnick, pinned this evening by Dr. Didion. She says, "Thank you to everyone who helped me get here. I'm out of here, y'all. Peace." Julia Mueller is pinned this evening by Dr. Didion. She wants to thank Mom, Dad, her husband Kevin, and family for always supporting her. Shout out to the Legend group chat with Sri, Taylor, Stephanie, Jill, and Matt. I couldn't have done it without you. Pinned this evening, Kazim Kanbar by Dr. Didion. He says, "Thank you, OU." Mahmuda Ali, also being pinned by Dr. Didion this evening. Shrividya Srinivasan, pinned by Dr. Didion this evening, says, "I would like to thank my family, friends, and incredible students in the ASD cohort. I couldn't have made it through this program without you all." Stephanie Wynn, pinned by Dr. Didion, says, "A huge thank you to my friends and family for supporting me through this program." Sophia Cosmides, pinned by Dr. Didion, says, "Thank you to all my family, friends, peers for their support throughout my journey in nursing school." Dunya Elisa, pinned by Dr. Didion today. "Thank you for all the great instructors who have paved the way for me into the profession of nursing." Matthew Kniff, pinned by Dr. Didion today, says, "I want to thank my amazing wife and parents for their unwavering support and encouragement throughout this journey. I also want to thank the rest of my cohort for the fond memories and the mutual support throughout the program. We all made it through because of each other, so well done, everyone." Kelly Prince, pinned by Dr. Didion this evening, says, "Thank you to all the professors at OU and my family for supporting me throughout this program." Mackenzie Kelly is pinned by Dr. Didion this evening. She says, "I would like to thank my family and friends for their support through this intensive program." Vanessa Hanna, pinned by Dr. Didion, says, "I would like to thank my family and friends who supported me throughout this program. I would not have done this without you." Matthew Mishley, pinned by Dr. Didion, "Thank you to my parents and Crystal for supporting and cheering me on through nursing school. Thank you to the OU faculty for always being there to help and share their knowledge of nursing." Congratulations. So the pinning ceremony and the pin that each graduate has received is distinct, and it was designed to represent the specific school. And our particular pin was designed by for Oakland University by Judy Ganton, and she was a member of our first BSN graduating class. So when our graduates wear their pin, you're representing Oakland University School of Nursing with every interaction you have with patients, their families, and coworkers. We are so grateful that you've chosen Oakland University School of Nursing to pursue your BSN degrees, and we know you're going to represent us well. And at this time, I'm going to head and invite Dr. Book back to the podium.
Congratulations again to all of you. Another important nursing tradition is when nursing graduates recite the Nightingale Pledge together at the pinning ceremony. Florence Nightingale is considered the pioneer of nursing. She tended to wounded soldiers on the battlefields of the Crimean War and acquire the nickname the Lady with the Lamp because of her routine of making rounds at night, tending to the wounded soldiers. She paved the way for professional nursing, and in honor of her contribution, the Nursing Pledge was named after her. It was first recited in the spring of 1898, and its recitation has since become a revered tradition for nursing graduates everywhere. Graduates, if you could please rise and join me in reciting the Nightingale Pledge, that would be great. So we will say it together. I pledge myself here before this assembly to practice my profession with integrity. I will endeavor to maintain and elevate the standard of nursing, both as a science and as an art. I wholeheartedly recognize the importance of high standards of care and of personal accountability. I devote myself to the healing, protection, and welfare of those committed to my care. I accept a duty to work for the improvement of health in the communities in which I live and work. I will hold in confidence all personal matters committed to my keeping and will respect the privacy of medical information. I will act with compassion in ethical matters. I will not knowingly administer or consume any harmful substance. I commit to interdisciplinary collaboration and lifelong learning. I fully acknowledge the seriousness of the responsibility that I accept in my calling and the significance of this pledge that I take today. Nicely done. Great job, everybody.
Nurses, as you advance your careers, I know you will remember the words of the Nightingale Pledge and your duty to your profession. We are so grateful again that you chose Oakland University School of Nursing to pursue your degree, and we know you're going to represent us quite well. We hope that you'll stay connected with us as alumni. Thank you to all the family and friends here this evening, here tonight to celebrate this important achievement. Your love and support should be applauded and celebrated as well. So let's give them one last round of applause. Thank you to the Student Nurses Association, SNAOU, pinning committee for all their hard work planning this ceremony this evening. Graduates, we will be taking class pictures immediately following our ceremony this evening, and since it's a nice night, we'll be able to go outside to get our group photos. We'll go right out back by Elliott Tower. A link to the photos will be provided following the ceremony so that you can view and order photos once they've been processed. Once again, congratulations to our BSN graduates. And this concludes our program for the evening.